John Doe is a Caucasian male in his 40s who was found under a picnic table by a jogger early this morning at a local park. Dr. Mel, the medical pathologist, is conducting an autopsy to determine the cause of death. On her initial survey, she notices a significant bump in the back of the man's head, consistent with blunt force trauma. She also notes petechial hemorrhages in the sclera of his eyes. These occur when the tiny blood vessels in the eyes burst due to too much pressure in the brain. Observation of the face shows multiple bruises and superficial lacerations on the forehead and cheek, as well as a reddish-purple rash on both cheeks and across the bridge of the nose. She scrapes off some of the inflamed skin and evaluates it under the microscope, noting several distinct histopathological features, including lymphocytic infiltration and hyperkeratosis. Dr. Mel then starts the internal part of her investigation. On examining the organs of his chest and abdomen, she notes splenomegaly, an enlarged spleen. Connecting this information with the histology findings, Dr. Mel is reasonably sure John Doe has systemic lupus erythematosus. Based on this information, she can try to help the police verify his identity so his family can finally be contacted. Lupus is an autoimmune disorder significantly less common in men than women. An alert goes out to all the local rheumatologists to see if this is their patient. 2 days later, they get a call from a rheumatologist who says he thinks that's his patient. He sends over the medical records of Rufus Humphrey, a 48-year-old man who, in addition to having lupus, was also hit in the head with a baseball bat 6 months ago at the same park that John Doe was found in. The CT scan from that hospitalization showed a large contusion in the occipital lobe of the brain. Dr. Mel evaluates the bump on the back of John Doe's head and sees that it is in a similar position to the location of the injury that Rufus had 6 months ago. Dr. Mel makes an incision in the scalp and evaluates the skull, which is sunken in and piercing his brain. This is indeed Rufus Humphrey. After his injury last time, he underwent a craniotomy to repair the skull fracture caused by the baseball bat. The titanium screws replacing his bone flap are still in place on one side of this injury. However, the titanium plate on the other side is bent, and the screw is missing. The part of the skull they had so carefully replaced before is now deeply embedded in Rufus's brain. As Dr. Mel delicately plucks the fractured skull from his brain, she discovers the missing screw. The brain's surface around the skull fracture is reddish-purple in color, especially where the bone is pressed into the brain. The rest of the brain is remarkable only for diffuse cerebral atrophy. Microscopic examination of the injured part of the brain demonstrates swollen axons and infiltration of inflammatory cells. Review questions. Dr. Mel examines both the gross and microscopic anatomy of Rufus's body. Explain how these techniques are different, citing specific examples in terms of scale of study, techniques used, and applications. Dr. Mel examined Rufus's anatomy using what type of approach? System or regional? What approach did Dr. Mel use to determine that the patient had lupus? Why was this a better approach than the alternative? The answers are in Part 2.